Hey guys, here to go over your elbow and or wrist exercises. These are kind of a two-in-one. It's going to be applicable to anyone that has carpal tunnel or problems with the wrist, as well as any of our patients who have the golfer's elbow, which is the medial epicondylitis, or the tennis elbow, which is on the lateral epicondylitis, the outside. And so the reason why it's applicable for both is because what we're doing is we're targeting the muscles of the forearm. Okay, so when the muscles on the outside of the forearm are overused, the extensors, they all insert here, and so that can actually lead to the tennis elbow if you think of a backhand in tennis. And then same thing for a golfer's elbow. When you're coming through on a swing, the forearm muscles on the medial side, they go to the inside of the elbow. So if you have the medial epicondylitis, it's applicable for that as well. And so the first one, self-massage. Okay, really simply, we just want to stretch out these forearm muscles. It's an overuse injury in most people, and so we want to stretch the muscles. And so you can use a massage gun, you can use a golf ball, you can use your own finger, and you're just trying to massage the muscle. And when you find those really tender spots, again, try to push in there, hold there for a second, get that tissue to release, and then kind of scan it again. You can do both sides, but again, you want to focus here for the outside and on the inside of the forearm for the inner elbow. Okay. The next one is the forearm stretch, and that's going to be a big focal point for us as well. And so again, if it's a medial epicondylitis problem, we want to stretch this side of the forearm. So you take the palm and it kind of faces outwards. You grab your hand and you pull down and back, and you should feel a nice stretch through here. And you may also start to feel a bit of a stretch on the inner elbow as well. If you want to go a bit deeper, you can actually make a fist and pull that down, and you'll feel a bit more of a deeper stretch that way. Same for the opposite side. If we're focusing on the lateral elbow, you're going here, the palm faces down, first with the fingers open, pulling down this way, and then with the palm pulling down that way. You can refer to the sheet. You want to do it a few times, holding for 10 to 30 seconds each time, really feeling that stretch. If you want to go a bit deeper and a bit more intensely, you can get down on the ground and kind of do something similar. This also is really beneficial for the wrist as well, because we get a bit more wrist mobility this way. So for the carpal tunnel patients, come here first, and then with as much body weight as you can tolerate, lean back, and you'll feel that whole stretch there. Same thing this way, onto the outside of the elbow, leaning back. And again, for general wrist mobility, you can kind of do here and here as well if you're working on the wrists. Once we've gotten a bit further into your care where you start to feel significantly less pain, we can then work on strengthening the forearms as well. And so with a very light dumbbell, we don't want to overdo it, because if we overdo it, we're going to kind of recreate the problem. But we want to strengthen for long-term health. So just with a very light weight, we're going to go here if we're strengthening the inside elbow, and you give yourself a bit of support. And just with a very light dumbbell, you're just doing curls this way. Okay. Same thing if we work on the outer elbow, we're coming here, grabbing that dumbbell and coming up that way. Okay. Again, you don't want to do really heavy, because that will recreate the problem. We're just going very light, trying to stimulate those muscles, getting them to rebuild and get a little bit stronger. And then finally, grip strengthening. This one's going to be applicable for the carpal tunnel patients. If we're trying to strengthen the wrist, as well as move and shift those carpal bones, we want to grab a ball. It can be a tennis ball or a massage ball, and you're just trying to grip and move. You'll see some people do it like some people have like the two little marble balls that they do, and and that's all working on that grip strength. It's helping to shift those carpal bones, take pressure off the carpal tunnel area, but get our wrists stronger as well, so that in the future we hopefully have less issues. If you guys have any questions about these exercises, not sure what you should or shouldn't do or what you should be feeling, just let us know at your next video.